Uh, as we all know that we have completed 6 years in this April 2024 after we launched the first Ayushman Arogya Mandir in Chhattisgarh. And as rightly emphasized by Secretary Sir and ASMD ma'am that we have completed the number of operationalization, but we are yet to achieve the objective of the complete services and the real objectives of providing the 12 services from these centers. In the gathering of these states, many states have performed very well, but many states have to catch up to the real requirement of the things. As in detail, ma'am has already told the requirement and expectations. I will just supplement the PPT by some numbers. So as I have shown that at national level, at 1,99,000 facilities have been approved through various schemes like NHM, 15th FC, Abhim. And out of that, 1,73,000 have been operationalized so far as per the portal, and there is a gap of 13%. We can see the progress of the states which are present here. Many states have completed as per the target or the approvals, like Telangana, Andhra Pradesh, Kerala. But there is gap in a few states like UP and Bihar. There is a huge gap. So we need to work on these so that operationalization number is complete in due time. This is the status of the operationalization and the services being provided. I have kept the number of operationalized Ayushman Arogya Mandir excluding the number of Ayush centers. So these are the centers which are operationalized from our sub-health center, primary health center, urban ARMs and urban PSCs. We can see that states are performing better when we count the number of minimum 9 services. But when we count the services of 12, then the progress comes down. So I have given the status where we are at present for the 9 and 12. Request is that the states who have already provided 9 services on facilities, they can easily catch up to the 12 in due course. And also we have to focus on the new centers to increase our services. Today's presentation will be limited on the 4 or 5 points of the Ayushman Arogya Mandir, where Government of India is also focusing for the next 5 years. So 5 years plans we are working now. And for 5 years plan, this has been a major task in Government of India in NHM. One of the tasks that we will operationalize the arms and we will also provide the services. So threadbare analysis has been done in the Government of India that how we can improve this operationalization number and the services. So obviously 5-6 points comes out. Like what are the numbers of operationalization, which are the centers which are not providing 12 services, what is the gap in the HR, what is the gap in the training, and what has been the status of teleconsultation, what has been the status of the Jan Arogya Samiti, so that holistically we can move on this topic. So this is the first where we all have to work, which are the centers where the gap of the providing of services is there. And these numbers is as per the Ayushman Arogya Mandir portal. We also have seen that despite the numbers have been updated on the portal, in the field there is some gap in the status shown in the portal and the services being provided to the patients. So we have to see that all the services which are declared on the portal, they are being actually provided by also our team also. We have added few indicators on the Ayushman Arogya Mandir portal. Recently, we have released a letter to the states because we want to assess that how many services are being actually provided by the centers. Few indicators were already existing in the HMIS, but holistically we have kept these indicators now for expanded package of services. Last month, a few days back only, this letter has been issued. We request the states that they should train their team to incorporate this OPD data and referral data also on their ARM portal. We have also emphasized that no new register has to be maintained for these indicators. Only the indicative coding or indicative color scheme can be done in the OPD register, so that based for all these services, numbers can be counted at the end of the month and they can be updated on the portal. We will also reduce the indicators from the HMIS. Once this system is stabilized, we will reduce the numbers from the HMIS, or we will take something based on API, so that team has to enter the data once in a month or once on any portal. This is the status of the availability of CHOs in the ARM sub-health center. The number of target, as I have shown, is the projected number. So as we are working on the 5 years plan, now we have kept that in 5 years, minimum 1,80,000 centers or the Ayushman Arogya Mandir must be fully functional with the desired objectives. So based on that, we have calculated that how many sub-health centers would have to be operationalized and how many primary health center would have been operationalized. So based on the projected number of sub-health center, we have calculated some target for the states. Like for Bihar, we can see that out of 8764 projected number of sub-health centers, the CHO should have been available at the end of the 5 year, and also they must be trained. So unless we work on the in the first year itself for the recruitment, we will not achieve the numbers in the last fifth year. So this slide attempts to give the number that on what number we have to work for the next 2-3 years. For these numbers, we have to start the recruitment drive. We have to publish the vacancies. We have to see that there adequate applications have come, and the exams and all those things formalities are done timely. So we can see that large gap is in Bihar, Haryana, Uttar Pradesh, and Telangana, and smaller gaps are there. Maybe we should see that our domain is not the 1 year. We should hire the manpower based on the 3-4 years domain down the line. Similarly, this is the status of MOs. I have also taken the PSCs as projected number. How many PHEs have been operationalized today, and what PSCs must have been operationalized to achieve the 1,80,000. We will share the state-wise numbers in separate groups also. So we can see that there is a gap of projected numbers of MOs and what is available in the MP, Haryana, Bihar. MOs are available in the state otherwise also. So maybe there can be a need of rationalization of the MOs, so that our Ayushman Arogya Mandir PSCs are definitely having the MOs. So this exercise may be a help for the states. Few states are not having gap, but few states are having gap, as we can see on the screen. Again, this is a status of training. So training we take from 2-3 sources. Like training we also take from Ayushman Arogya Mandir, where everyone is shown as trained. Training we also collect from the Shashakt portal, where the data is coming 21 onwards. And this data is based on the information taken from the states. So we can see that West Bengal is having high gap of almost 100%. Maybe this is the information has not come properly to us in the MIS, which we are collecting from the state, so that we are relying more on the state data as of now. In the due course, we will take the data of Shashakt portal. In Shashakt portal, as I said, that 21 onwards training are incorporated. So if we take the Shashakt data, that will also not reflect the complete picture of the training. So I have taken this data from the state MIS. I will request the states to share it again if there is any change or the update. But there is a need of training, and for this training, we have started national level master trainers training in Delhi. Based on after the completion of the master trainers training in Delhi, we will expect the states to frame their state level training, and then district level training can be imparted till the end of the December or January. This request is that previously many trainings were given online. So online training doesn't work for the expanded packages. This time in master training also we are emphasizing on skill-based training. So this is a request that when you plan the state level training, you should see that actual handhold training is done for the CHO and ANMs. As ASMD has said that for cancer training, the theoretical training will not work unless we are training them to do the physical training for the cancer screening of cervical cancer or breast cancer. Similarly, the status of MOs, I will not go in detail in the numbers. So it is a request that MOs training should also be ensured, and they should also be updated on the Shashakt portal. This is the status of drugs availability as per the ARM portal. We have seen that states have updated what drugs they have available. They have made available in the centers, but we have also seen that on DVDMS the drug availability status is different, and also in DVDMS the number of molecules are lesser than what we are expecting in our national EDL. So as ASMD has already told in detail, so I will not go in detail, but we request that whatever actual status is there in the state, if they want to update it on ARM portal, it should be updated, so that, because we are reporting at various forums that 80% of drugs have to be provided by certain percentage of facilities. It is being reported in output framework also, and in 5 years plan also. So this is again a major area where everybody has to work. Similarly, the diagnostic status, we are trying to take the diagnostic status from the DVDMS. DVDMS has the information of purchase of reagents and other diagnostic consumables. So we will take the information how much consumables are being procured for diagnostic, and again diagnostic number has to be updated regularly. And we have seen that many states are not having the adequate number as per the essential diagnostic list. JAS formation is another component where we need to work, and Uttar Pradesh and West Bengal are having a gap. Many other states are catching up quickly. These states are requested to see that JAS constitution is done or reported adequately. Now I will just go on good practices. So in Andhra, family doctor program is running, and many must be aware from the surrounding area. They depute doctors to visit the homes, and Didi's Rasoi is also done by the Bihar. West Bengal, Swasthya Ingit, through Swasthya Ingit teleconsultation is being focused largely, and it is giving benefits of teleconsultation, and it is providing specialist services. In Alana program, home visit is done by for palliative care by Telangana, and Mahila Arogya Day is also being organized. In Kerala, there is a synergy between NCD management and palliative care services, Ayushman Arogya Mandir. In NCD, Tamil Nadu also has done wonderful job. They are providing drugs to the state, to the home. And DVDMS is being used very well in UP. Their sub-health center are also using the DVDMS. Many other programs in other state also, like in Uttarakhand, Doli Palki program is running. In Meghalaya, they are using the village health council for the improvement of the health status. So many good practices are done by the states. We can learn from each other and implement them. Digital good practices, I will not dwell in detail because we have another session for the good practice by the state. But states are using many innovative schemes for their good digital things. But we request that no new portals and no new experiments should be done, because it is adding burden for the health workers only for the state. Challenges are, we all know, so I will not go in detail. We are having large number of population covered by Uttar Pradesh, and there is a poor mechanism for continuum of care. So all these things should be kept in mind, and based on that, we should decide the way forward. Way forward also, like in infrastructure, we can have something like branding we have to do. HR, I have already told that they have to be trained. Then IT and teleconsultation, we have to integrate all the portals. For service delivery, we have to improve the upward and downward referrals. And VHND, ASMD has told that VHND can be utilized for expanded package of services. It is being used for limited purpose now. We can use that for expanded packages also. So I will stop here. Thank you.
Thank you, sir. I would like to invite State of Andhra Pradesh to present their best practice.
Yeah, good morning. This is basically to strengthen the delivery of services at Arogya Mandir, Ayushman Arogya Mandir. So family doctor program is